I have been prone to like sprain my back every now and then, and you've given me trigger point injections. And when someone I know has like that similar pain and they're not a member, or like I'm trying to help them figure out where to go, I'm like, you should find someone who does trigger point. But they're like, oh, I think that's something you have to get referred to a PT, get examined, and then they might do it. So tell us more about that. Why did you get into like those kind of urgent care services?
Yeah, so a lot of people, like, you know, in primary care, when the service when I was at USMD, nobody was doing procedures or injections or anything like that, because it was kind of like in and out, and then they refer patients to everywhere. For me, I train as a physician who wants to take care of my patient as a whole, kind of like talking about like going back to the old world, like where you're the doctor that take care of everything, but I always kind of talk about we're also modern, we're always kind of updated with new things, like with peptides and all this other stuff. So we're kind of like that old and new school kind of thing, where as I want to be able to take care of my patients, because I feel like I know them, I feel more comfortable treating them, instead of having to refer to somebody that I don't really know or trust. So in this case, like, you know, patients, like the other day, I had a patient, he was on his way to work, but his back was hurting so bad. He sprained it, and he's like, oh my gosh, doc, my back hurts so much. I can't, I need to go to work, but I can't. What can you do to help me right away? Yes, generally we can give them muscle relaxant and anti-inflammatory, but muscle relaxant sometimes makes them sleepy. And so if he needs to work, he can't take the muscle relaxant like while he's flying or driving, right? And so what I did was have him come in, do some trigger point injection, his pain relieved right away. The next day I got a message, Dr. Nguyen, that shot works amazingly well. I went to work and had no issue at all. So things like that was able to kind of really, really help patients.